Hello and welcome. Today we're delving into a complex and often challenging neurological condition, Neuro-Behçet's disease. This rare manifestation of Behçet's disease affects the nervous system, leading to a variety of neurological symptoms. Join us as we explore its causes, effects, diagnosis, and management. The exact cause of Behçet's disease, and therefore Neuro-Behçet's disease, remains unknown. It's believed to be an autoimmune disorder, meaning the body's immune system mistakenly attacks its own tissues. Genetic predisposition appears to play a significant role, with certain genes, particularly HLA-B51, being strongly associated with the disease. Environmental factors, such as viral or bacterial infections, may also trigger the condition in genetically susceptible individuals. However, no single definitive cause has been identified. Neuro-Behçet's disease occurs when the inflammation associated with Behçet's targets the central nervous system. This inflammation can affect various areas of the brain, spinal cord, and optic nerves. The inflammatory process can lead to vasculitis, which is inflammation of the blood vessels, disrupting blood flow and causing damage to nerve tissue. In severe cases, it can lead to lesions, demyelination, or even stroke, like events within the brain. The specific neurological symptoms depend on which parts of the nervous system are affected. Behçet's disease, in general, is relatively rare, and Neuro-Behçet's disease is an even less common complication. Its prevalence varies geographically, with higher rates observed in countries along the Silk Road, including Turkey, Iran, and parts of Asia. It typically affects individuals between the ages of 20 and 40, although it can occur at any age. Men tend to be more severely affected than women, particularly with respect to neurological involvement. The signs and symptoms of Neuro-Behçet's disease are diverse and depend on the location and extent of neurological involvement. Common symptoms include headaches, fever, and altered mental status. Patients may experience stroke-like events, leading to weakness or paralysis on one side of the body. Other neurological manifestations can include seizures, visual disturbances like double vision or blurry vision, speech difficulties, balance problems, and cognitive impairment. Some individuals may also experience peripheral neuropathy, leading to pain, numbness, or weakness in the limbs. Because of the wide range of symptoms, diagnosis can be challenging. Diagnosing Neuro-Behçet's disease can be complex, as there is no single definitive test. The diagnosis relies on a combination of clinical criteria, neurological examination, and imaging studies. The international criteria for Behçet's disease, which includes recurrent oral ulceration plus at least 2 of the following: recurrent genital ulceration, eye lesions, or skin lesions, is often used as a starting point. Magnetic resonance imaging, or MRI, of the brain and spinal cord can help identify areas of inflammation or lesions. Cerebrospinal fluid analysis may be performed to look for signs of inflammation or infection. In some cases, a brain biopsy may be necessary to confirm the diagnosis, although this is rarely done. While there aren't strictly defined types of Neuro-Behçet's disease, it can be classified based on the primary area of the nervous system affected. For example, parenchymal involvement refers to inflammation affecting the brain tissue itself, leading to symptoms like headaches and cognitive changes. Non-parenchymal involvement may affect the blood vessels supplying the brain or the meninges, the membranes surrounding the brain and spinal cord. Neuro-Behçet's disease can also be categorized based on the severity and progression of symptoms. Treatment for Neuro-Behçet's disease focuses on suppressing the immune system and reducing inflammation. Corticosteroids, such as prednisone, are commonly used to control acute flares. Immunosuppressant medications, such as azathioprine, cyclosporin, and methotrexate, may be prescribed to prevent relapses and reduce long-term inflammation. In more severe cases, biological therapies, such as TNF inhibitors or anti-IL-17 antibodies, may be used. Symptomatic treatment, such as pain management and physical therapy, is also an important part of the overall management plan. Regular monitoring by a neurologist and other specialists is essential to track the disease's progression and adjust treatment as needed. Currently, there's no known way to completely prevent Behçet's disease or Neuro-Behçet's disease. However, managing risk factors and maintaining a healthy lifestyle may help reduce the severity of the condition. This includes avoiding smoking, managing stress, and treating infections promptly. Genetic counseling may be beneficial for individuals with a family history of Behçet's disease who are considering starting a family. The prognosis of Neuro-Behçet's disease varies depending on the severity and extent of neurological involvement, as well as the individual's response to treatment. Some individuals may experience mild symptoms with infrequent flares, while others may have a more chronic and progressive course. Early diagnosis and aggressive treatment can improve outcomes and prevent long-term neurological damage. Research into new treatments and biomarkers for Behçet's disease is ongoing. with the goal of developing more effective and targeted therapies. Recent studies are exploring the role of specific immune cells and cytokines in the pathogenesis of the disease, which may lead to the development of novel therapeutic targets. Clinical trials are also underway to evaluate the efficacy of new biological therapies for Neuro-Behçet disease, offering hope for improved outcomes in the future.